And welcome back. And we are moving into our first conversation for today. This is a story, of course, that has captured the attention of Belizeans across the country. We're talking about confirmed cases of H1N1, also known as the swine flu in Belize. And joining us this morning, we have Dr. Russell Manzanero, who is an epidemiologist for the Ministry of Health. Good morning and welcome.
Good morning, everybody. Thank you for having me back.
Yes, and thank you for coming in to have us understand the scope of this issue and just how concerned we need to be. I want to start off, though, with talking about H1N1, which is a type of flu. And I think if people reflect back to when we first started to talk about H1N1, there was a major scare because people were dying, it seemed uncontrollable. What's the difference between then and now?
Okay. Well, actually, when you talk about the influenza virus, you're talking about different subtypes. You mentioned H1N1. Those are the influenza type A, because we do have type A and type B. The difference is, since then, it was introduced in 2009 when we had the scare, and we all were familiar with the scares in Mexico. Yeah. With the swine flu, that was how it was termed. The transmission from pig to humans and then human to human transmission. The problem then was that most of us didn't have the immunity towards it. So it was a new virus in circulation. Many hadn't developed antibodies against it, so it pretty much affected many individuals. We had many deaths because of that same virus then. Since then to now, actually, well, the virus stayed. So it's here, it's in circulation, but we started developing our antibodies. We have the vaccine to prevent. And so now it has become much more of a seasonal flu, just that the severity is still there as well. So that's the difference now, that it is able to be, we can prevent it. Yeah. So as long as we prevent it, take our measures, it is controllable.
So. What is the difference in terms of way it operates from a regular flu? What is so special about this strand?
Well, actually, they all pretty much act the same. I mean, when you talk about influenza virus, you're going to have the same symptoms. The headaches, the body aches, the tiredness, the fatigue, all of that. But when you start talking about more the H1N1 and the more severe strains, that's when you start having an abrupt, like a sudden onset of fever. You can have the fever. The fatigue becomes even more. So all of that. In children, for example, they might not be getting enough oxygen, so they start getting blue, they turn blue. So all those are warning signs. But it pretty much acts the same. So the flu actually comes on and you're going to have all the general symptoms, the headache, the tiredness, the stuffy nose, the cough, sore throat, all of that. But then when you start having those warning signs is when this is something that you need to act on quickly, no?
Yeah, yeah. Now, looking at what the current context is, it was last week, I think, or the end of the week before, that the Ministry of Health sent out a press release saying that we do have confirmed cases of H1N1 in the north at the time. And now we've had cases in Belize district. Tell us about the surveillance system that is in place in the country, because surveillance is what's going to help us in minimizing any spread.
Sure. Well, actually, when we heard, before that, when we did our confirmatory tests, we actually knew of the cases that were coming out from Yucatan and Merida. So that was when we were actually on alert that there is a H1N1 pandemic. That's the type H1N1/09. It's related 09 because of 2009, the swine flu. So that's the reason why we have that termed like that. And that was the reason why alerts already came out. And since then, we're actually very active. We started engaging, especially the northern region, but in general, it was the entire country, to actually look over what they were going to engage in at their levels. Yeah. All of them sent in what we would call our surveillance plans. So they actually know exactly how to target different populations, to go to businesses, to go to, for example, in the north especially, they would go to the casinos, they go to free zones, they go to the border management. They met with all the officials to see how they can recognize and find and identify individuals who might be very ill.
Yeah.
So those were a few things that they did. Of course, going to the media houses and giving a little bit of education there. The clinics, the hospitals, all of that was part of what we would call a surveillance plan. They already knew what it was because we have our influenza plan. So it's not pretty. It's pretty much on that we actually fell on that we actually caught these.
Yeah.
So our plan is that anybody who is severely ill, who gets admitted because of a flu, and because probably is very ill with a pneumonia or a bronchitis, or children who are actually admitted, those are the individuals who we would screen.
Yeah.
Or individuals who come, for example, just as a walk-in and you see them very ill, you take swabs. And this was actually how those cases were actually caught as well. So the cases that we have actually are individuals who came in with a travel history. And of course, because of the travel history to Merida, that raised an alarm.
Yeah.
So after taking the samples and sending him, that was when we got the news, and we later shared it with you on the end of the week.
So two things. One, you clearly said pandemic. What is considered a pandemic?
A pandemic is when you have a new strain of a virus or a bacteria or anything that is in circulation now. Could have been from an animal or human to human, but generally it's new. So we, as humans, we don't have the immunity towards it.
Yeah.
Spreads quite quickly, develops in an area and starts spreading very fast.
Yeah.
Start forming other pockets.
Yeah.
Of course, with globalization and travel, it's much faster.
Yeah.
So all of that starts spreading at a global level. So that's when it becomes a pandemic and
Yeah.
a concern that it is something now.
So there's a difference between pandemic and endemic. Endemic would mean then that it's already here and it just
Yes.
keeps on circulating.
It's here and it's here to stay.
Yeah. Okay. And then the second thing is, you said one of the recent additions to the labs here in Belize is that we now have the capacity to test for the types of flu. Is that right?
It is.
Yeah.
So it is a huge step for us. For Belize itself to be able to test.
Yeah.
The problems before, and you're aware when we deal with ARBO, is that the turnaround time that we used to have when we used to send out. You get it back in 2 weeks. So by then it's pretty much okay. So the patient is waiting, doctor's waiting.
Yeah.
Now we have the capacity to actually run tests for influenza. And we even have, I was speaking with the lab director, and she was mentioning that we have the capacity to actually go specific to test for the H1N1, the pandemic virus. So,
Okay.
so
And
we
then
have that.
we got to demystify this, because using history again, 2009 we had the H1N1 scare. A long time ago there was the avian flu too. And if we just go back to just last year, there was a devastating flu sweeping across the United States. And I know people in Belize were extremely alert, but that strain never came here. We didn't see that type of effect. So there seems to be a lot of complexities to understand. I mean, a flu is a flu to me. I feel terrible. I just want to feel better. But how does one know? And can you break it down for us?
I mean, in the US, they do have the other strain of the influenza, H3. So those are in circulation. So pretty much I would have to recap on certain things that what CDC does, for example, to determine your type of vaccines that you're going to have in your country. You have to look at the different strains that you have in circulation. And the way how it gets done is by testing, by actually getting the samples, testing and identifying what those strains are. So if we don't have that, then we can't actually determine which one is in circulation. And that's the reason why now that we have the capacity to do it, that's the reason why now we're trying to get all these subtypings and the ones that we send out to CARFA. So we do have, but we have limited. CARFA is our referral lab in Trinidad. So they are the public health agency in the Caribbean that actually does the testing for member states. They've been testing for many of our tests now for influenza as well. And they've done, but not, I guess the numbers that we send out for influenza testing is quite low. So for us to have an understanding of the different types and to see if that strain was actually in circulation here in Belize, then we needed more tests. We need to run more tests to identify
So what we're saying is there are many different types of flu.
There are many different types. There is influenza A and B, which is the respiratory flus that we have. Those are now the seasonal flus that we call, that are in circulation. And then we have those that are the common cold, the flu viruses, others that we have in circulation. Those are the more common ones that can affect certain populations as well. The elderly and the very young can get those viruses as well, and it can still be severe as well.
Dr. Ross, if I could say that.
Sure.
Belize is not necessarily, and I think the Ministry of Health is doing excellent work in this area. I feel very proud of the fact that we have not had the virus affect us in the way that it could possibly affect us. That must be evidence of good work that the Ministry of Health is doing. On the other hand, though, are we a bit lucky? More so than just doing everything right? Because take, for example, a simple incident of pink eye that our northern neighbors had. That hit us terribly.
Yes.
And H1N1, it's over the border. You'd assume that our mechanisms aren't as strong to resist it. So is it just that the virus didn't come the way that it did, like a hurricane kind of went a little bit north, and we're lucky, or is it that we have everything in place that we can deal with this thing properly?
You know, when you talk about bugs or any kind of virus, it's a matter of time that it would come to your area. What's in place, what you have in place, as you mentioned, is how you're going to actually help the community, how you're going to tackle it and all that. So when you talk about surveillance plans, that's part of it. But again, just like the conjunctivitis situation that we were here as well talking about it, it's a lot, it depends a lot on the individual, on the community, on everybody, because it's prevention. I mean, when you talk about flu, it's prevention. It's you do measures to actually protect yourself, all of that. And one of the biggest things is vaccine. Have you been immunized against the flu virus?
Yeah.
So if I ask here, how many has been immunized? Those are the things that we want to look at. So those are the first things that you want to do. Prevention is get your vaccines.
And that's what that's a great point, because I think where we have seen, like with pink eye, where it really was quite a spread and very quickly, we've also seen where things like measles or other diseases that have impacted larger number of people in other countries didn't have quite the same effect here. Is it that we are seeing, when it comes to the flu, more people taking the vaccine? Are we seeing that shift where people are being more preventative in their frame of mind?
I guess when you talk about the comparison measles and rubella, it is part of our surveillance as well that we have with immunizations in children and those that. So pretty much it's something that we have gotten a hold of because it's part of this regimen of immunization for kids. So when you talk about under 5 and you're talking about measles and rubella, that's the way how we're trying to, it's been working.
Yeah.
Now, when you talk about the flu and you're talking about individuals, you'd encourage people to get their vaccines and all of that. It's quite different. I mean, people don't like needles. That's what I hear the most.
So it's easier for the kids to get vaccines than the adults. That's what we're saying.
I think because you take them, you take them, like the parents take them.
You have no choice.
You have no choice, right? No, but as adults, I think we have to be responsible. We need to know we talk about healthcare providers, for example. They should be the front line. They should be the ones who have all their vaccines met, hepatitis, the flu, because they are the ones who are engaging with the public. I mean, it is your responsibility. You as a professional should know that I need to take care of myself to be able to work along with you, not to take home anything to my family. So you're the ones who actually should be getting your vaccines. And that's the way how we try to encourage everybody else. So when we talk about the flu vaccine, for example, we want to target specific people, pregnant women, individuals who are over 65, those who are older than 6 months, all that. So we encourage you to get the vaccine, the flu vaccine.
Doc, can I ask a wider question? I hope it's within your purview. I hope you can allay my fears. I'm looking at the number of flu viruses or bugs that have come out. We had a bird flu that affected chicken. We had the one that affected beef. What was that? Foot and mouth?
Yeah, but
what it was?
And foot mouth.
Yeah.
Yeah, and then now we have swine flu. the source of these things seems to be a connection with animals. This is something that we are treating these animals with. The source of it to me is more important. I have another conspiracy theory that I want you to address a little bit later.
Okay.
But is there something in terms of the way the world is dealing with our food preparation for the farming of these animals for slaughter?
I guess when you talk about public health, it engages a lot of stakeholders. It's not only human health, but it involves animal health as well. And I think what you touch base there has a lot to do with the amount of, for example, substances that we're pushing into the products, into the farming products, into the plants, into the everything. Mm-hmm. So when you talk about antibiotics and you're trying to push those in, you naturally, the bugs will start getting resistance, and that's when we start talking about antimicrobial resistance. When that happens, of course, the animals start getting affected, and in the end, as humans, we're the ones who will see the consequences. So we start having illnesses that weren't there before, all of that. So all of that contributes to how we're actually managing most things from the very start.
You know, from a public health standpoint, we don't have the broader conversation as much as I would see in other places. And I think two of the things that you mentioned are so important. The rest of the world is consumed with this idea of a superbug eventually affecting masses across the globe. Similarly, the issue, and I know this is a relevant issue for Belize, we've had conversations here, you call it antimicrobial, but in Belize we just say antibiotics. Antibiotics resistance is also a major concern. If we think of how easy it is to get from a corner of Asia to Belize in sometimes 24 hours or less, anything can be here. And I think Ebola was a great example of how quickly things could spread. What are we, as Belizeans, perhaps not being very wary of? What are we missing in our own healthcare plans? Could it be hygiene? Could it be adherence? Could it be, these are all things that I've heard before, but I don't know if everybody is aware that we have a stake in being able to prevent these types of things as well.
Oh, of course, definitely.
That's how it's superbug. That's yeah.
No, but I mean, if you're taking as we all do, we want to be responsible. I mean, we have families, we have individuals we go back home to. We want to take care of them as well. So you should be responsible to take your own measures. Mm-hmm. It has to do with hygiene. It has to do with personal hand washing, for example, in this case. It has to do with your immunizations, taking your shots. And of course, when you start talking about superbugs, is not trying to just go to the pharmacy and getting over-the-counter medications, because that's where it starts. Yeah. I mean, when you start a treatment, you should complete the whole treatment, things like that. So those are the things that we're actually, on our own, we're actually creating. So we're the ones who are actually creating these superbugs as well. So it depends on us. We have a lot of responsibility too. Yeah. We should take our own measures, as you mentioned, and we should be responsible. Okay, so we'll get to the hygiene issue in just a bit, but I want to talk from Ministry of Health perspective. If we know that, and I'll give the very easy example, and I was joking with you earlier, sometimes I feel like all of Belize may be resistant to amoxicillin, because everybody takes amoxicillin for everything. But technically, I should not have access to it. I should not be able to purchase it over the counter. But it happens, and it happens very often, and we self-medicate in this way, which is what leads to my body gets used to it, and now it doesn't work on me. What from the Ministry of Health standpoint is being done to stop it from even being accessible to me so that I don't overuse it? Yeah. Well, recently we have the Drug Inspectorate unit that's actually looking at all of that. We do now are enforcing that all pharmacies, they need to be accredited and licensed to start with, but they need to enforce that, especially for the antibiotics. Yeah. We're talking about antibiotics here, so it's that part that we want to actually, whenever somebody comes to you, you need to have a prescription with the stamp and a signature of a certified physician. Yeah. So those are the measures in place, and I know most of the pharmacies are already on board, and the Drug Inspectorate unit is enforcing, and they are actually adhering to it. So you're going to see more. You can't just go now and say, I want it. It's very few cases that I think would happen now. Yeah. But those are more for antibiotics. You can still get over the counter certain medications. Yeah. We're talking about more the antibiotics. Yeah. Okay. And then let's move to the hygiene part, because I recall one conversation that I think has stayed with me a very long time, that
when there was this study done on gastrointestinal issues in Belize, the most common, I think it was a bug, I don't know, virus, bacteria, whatever, was actually one that was a result from poor hygiene. In other words, people go to the bathroom, don't wash their hands properly, or interact with food and serve it, and that is predominantly what affects most Belize. It was a rota, I think, maybe.
Yes.
Flus are the same. It's hygiene. Quite a number of these diseases just boil down to how clean and hygienic you are in washing your hands, coughing properly.
Yes.
How do we get people to realize that this is essential? So, you know, it always bugs me because every time I see someone come out of the bathroom, I'm like, I wonder if they wash their hands, you know?
No, you're right. And you talk about rotavirus. I mean, they're all viruses. I mean, they're the same, and it's the same prevention measures that we're going to take.
Yeah.
I mean, when you talk about hygiene and all of that, your hand washing, you should be washing your hands often.
Yeah.
When you talk about cough, you have cough etiquette. Of course, you're going to cough. You cough in your sleeve. We're trying not to encourage coughing in your hands.
Because you still touch people
yeah,
and things.
you touch the surfaces, you touch something else, or a handshake, a body contact, and it spreads that way. The virus stays on the hard surfaces for a while, so that's the reason why you want to encourage the cough etiquette the right way, cough in your sleeve or anything like that. The proper hand washing, the use of hand sanitizers. Yeah. I see many people walking on rugs, you know, they're coughing on the rug and then the bucket wrong. Okay, that's bad because you had the bucket wrong right there. So what you want to do, if you're going to do it, hold on to your tissues, cough in your tissues, sneeze in there, and then just throw it away. You are on your own. I think when you start talking about public awareness and you're trying to encourage individuals what they should do or shouldn't do, it starts at a very low level. I think it starts with the children. I think that's where we want to focus. They're the ones who actually need to start realizing what's there. I mean, adults can hear it and hear it and hear it and say, okay, well, probably we should start targeting different groups. So that's what we do. Yeah. We target schools, we target the high schools, we go to businesses, all of that. So that's the way how we're trying to do it.
You know, in one of the slides that just came up, it was suggesting that it's the bird flu and human flu that combined, and somehow, am I misreading the slide?
Yeah.
That it's the pig and then the pig then...
What it's trying to show you is actually how the mode of transmission can be from animal to human. That was the way how it started with the avian and everything else, so that's how it started, but it's not because of that.
Yeah, this is the slide.
Yeah.
See, the bird flu, the human flu, and then the arrow is to the pig, which then is swine flu, and then it's transmitted. So that's a misread of the slide.
Well, what it shows there is that actually when you're talking about the pigs, is that the pigs' their respiratory system can actually get the viruses as well. They can get these viruses in their system and they develop the flu as well. So they have the flu symptoms and it's easier for them to transmit afterwards.
Yeah. Yeah. Wow. So, you know, we have to say at this time that we're actually joined by Dr. Ethan Gough, who's from the Epidemiology unit of the Ministry of Health. He's the head of that unit. And I want to ask a question. You know, we're having this conversation very calmly, and I'm sure Belizeans at home are saying, what? You know, find out how we can not get it, why people are dying, how we're just going to stop Belizeans from dying. Just how concerned should we be in Belize? If we hear cases of it happening right next door, how concerned should we be about a threat of catching H1N1 and worse, having a death as a result of it? Whichever one of you want to take it.
Go ahead. I think what it boils down to is again how you're going to take a situation. Yeah. I mean, it's your health, it's your family that you're concerned about. So definitely it's something that you want to take your precautions. Yeah. You never know when the strain that you're going to have is going to be very severe. I mean, the turnaround time or the way how fast it acts, it's quite rapid. That the decline or how you deteriorate is unknown. Yeah. So you want to take those measures to prevent those. I mean, the cases that we've heard of deaths and all of that is pretty much in the younger population. So their immune system, as we know, isn't as developed as adults. So there is a concern there. Individuals who are older, over 65, their immune system is weaker. Yeah. Individuals who are with some other kind of comorbidity, I mean, if they have diabetes, hypertension, or any other illness, asthma, especially asthma, that they can get these flu viruses, it gets worse, it worsens. So the cases there are very specific, so you need to be careful with all of that. I mean, the things that you're going to take and say, okay, well, should I be concerned? Of course. I mean, it's there. I mean, it's in circulation. It's around us. I mean, so now we need to do our part.
Is there any way of knowing? You know, I had a terrible flu for 2 weeks, and how do I know if I had H1N1 or if it's another, or if somebody gets sick today or still sick and saying, you know, I wonder, do I have it? Do I not have it? Is there any way to differentiate between what would have been the seasonal flu versus H1N1?
Only by getting tested. So that's really the only way to really determine what strain of flu you have, or if it's even influenza or some other respiratory virus.
Yeah.
Another virus that has been in circulation is RSV. In the region, I would say, respiratory syncytial virus that also causes a quite severe flu-like illness. So the only way to really know if you have the flu or some other respiratory virus, or even if you have the flu, if it's H1N1, is to get a test done.
Okay. Or is that what we're encouraging? Or only if you get hospitalized, then you go in to get tested?
Well, for our surveillance system, we have, I guess, a protocol that is in place to test people so that we know what viruses are in circulation. But our strategy doesn't involve identifying H1N1 in everyone.
Okay.
The cost is part of the consideration.
Yeah.
So if you're hospitalized, you'll definitely get tested.
Yeah.
If you do not require hospitalization, then it's sort of 1 in every 10 persons is what we aim to test.
Yeah.
I'm curious though. What's the purpose of a flu? It must have some biological or scientific function, like everything else. Just like getting gas has, you know, or whatever it is, has some function. Is there some ecological, what is it, evolutionary value in? Is it just population control?
Wipe out people like you.
Probably.
Wipe out people like you.
Probably. Is there? And secondly, since I have you guys on that, I have to share my conspiracy theory that that some of this might be science-based. There is one fictional position. I'm not saying that it's not real. This is a real, deadly disease. But is it scientists who, because daily scientists are in labs and they're experimenting with these different strands, they're trying to find vaccines. Is it that they simply, two things, something's going wrong in labs, or two, that the vaccines that they have been producing is causing the viruses to adapt and change? That's a mouthful, but.
Yeah, I don't know anything about that.
But it's understanding the nature of the virus itself.
Yeah.
Yeah.
Yeah, I don't know anything about the conspiracy side of it.
Yeah.
It's unlikely, you think?
I think that's unlikely, yeah.
Yeah.
I think that's unlikely. Just in nature, there's the process of natural selection. Viruses adapt naturally.
Yeah.
The flu, influenza is a virus that's known to just adapt gradually over time. So it's always changing from season to season. That's why the flu vaccine has to be updated every year. And then every once in a while, due to the fact that influenza can infect people, birds, pigs, you end up with different strains of influenza infecting the same animal, the same species, oftentimes pigs. And when you have different strains in the same animal, then there's potential for a big jump in the instead of a gradual change over time in the virus, you end up with a big change in the virus because
Which we're unprotected for.
right, and
Yeah.
then that's in layman's terms, that's the process by which these new influenza viruses pop up out of the blue, so
Yeah.
to speak. Yeah.
And is it significant that a pig can contract this disease? Because a pig is a scavenger. So it is designed to take on some very dirty things. It eats anything.
Yeah.
So is it significant that it actually comes from this animal?
I don't know if it's significant, but it's definitely an animal that's what's the term I would use? It's a good, for lack of a better word, incubator for having an infection with several strains or more than one strain of influenza or more than one pathogen at a time. Yeah.
So, since 2009, the Tamiflu has been produced, which helps to treat H1N1. What do we have Tamiflu in stock? Is it accessible to people? Is that the method of treatment that we're using at this point?
Yeah, the treatment, when you talk about severe cases and you're suspecting either this kind of strain is, we do have the medication in stock. We have Tamiflu in stock. We're actually looking at how we're going to distribute regionally to the different districts and health centers, how they're going to use it.
Mm-hmm.
I mean, but when you talk about that, you have to look at specific cases, the populations that you're actually going to target. I mean, if the individual is coming very severe, individuals will be hospitalized with a pneumonia, bronchitis. Those are the individuals who would actually get the Tamiflu. Mm-hmm. Individuals who are older, the very young, pregnant women, those are individuals who you want to target because not everybody is going to be getting the Tamiflu, but you look at the cases and the severity of those cases.
My other question has to do back with the surveillance. We have the Belize Health Information System, which is wonderful. You can access it anywhere in the country, and we know that it's being looked at outside of this region as really a trendsetter. But what we don't have is the buy-in from the private sector yet. So is there a mandatory reporting, mandatory testing that if I go to a private clinic and I possibly have H1N1, will they test me because the Ministry of Health says so?
The surveillance system that we have right now, the testing part of it, we're not doing that we have not included the private sector as yet. That's something that we need to look at.
Yeah.
We have not looked at that yet, as far as the testing goes.
Yeah.
But as far as reporting influenza-like illness, respiratory infections, yes, it is required that they do that, and we do get the compliance from the private sector in reporting those. Yeah.
And for Jane and Joe public watching, we are very dismissive of colds and flus. We self-medicate. We take whatever flu pack they give us at the pharmacy, or we buy whatever it is that we think will work for us. And I think, it always astounds me when I read numbers as to how many people die, not just from H1N1, but like regular flus around the world every single year. What is the danger of staying home and just saying, or going to work every day and struggling through a flu? What are the risk factors, and why does this regular cold and cough, as we know it, lead to death?
Yeah, again, it has to do with your immune system. I mean, if you are an individual who is probably diabetic, who's probably, for example, with asthma, and you're not taking care, you have to take certain measures to actually have your immune system up to par. You need to be resting, hydrating, and all of that. So when you have the flu now and you're adding that on, it strains. It's going to be an added strain to your body. So if you're not resting, you're not hydrating, that's when it can worsen and actually can develop to even more severe cases. Can lead to a pneumonia, to bronchitis, and that's when it can actually have a turn for the worse. Yeah. We do encourage that if you do have the flu symptoms, so that of course, just like any other viruses as well as flu viruses, it's rest, plenty of liquids, all of that. So those are the things you need to look at. But if you're noticing that your flu is getting worse in a day because it's sudden, what makes it different from the common flu is that the common flu, or the common cold that we call it, you might have a little sore throat, the stuffiness, but it's gradual. So today I might feel only bad or something like that. When you're talking about influenza viruses or the H1N1, it's a sudden setting. You feel really bad. You start getting body aches. You start feeling very tired. You might have fever. Because they're saying you have fever, it's not always. So some individuals don't have the fever, but you have all that generalized tiredness, the cough, the sore throat, all of that. So if you're noticing that might be happening to you, then that's when I need to go to the doctor. I need to take my own precautions then.
In terms of the surveillance system that we have in place, where we are most vulnerable, I would assume, is our port of entries. And with the introduction of persons who, as you say, traveled, could you talk to us about how that aspect of it is working? For example, tourists on a port of entries. Are our people there trained? What is there in place to deal with persons who are probably a threat? Because if I'm a backpacker coming all the way through, I'm tired. I probably went through jurisdictions that I probably was exposed. My hygiene is not the best. I might be a backpacker, and then I come to Belize to go. It's all what happens.
That's a very generalized statement.
It's very generalized, but it's a risk.
As someone who backpacked, I object.
As someone who has backpacked as well, I know it's a fact. But you can talk to us about what's in place for those.
At ports of entry, specifically, the ministry has public health inspectors at the airport specifically, and they're there to kind of keep an eye out for anyone that appears to be sick or ill. But the challenge with ports of entry is, I went to a meeting last year and I was talking to someone from another country where they have a good system in place for screening incoming passengers, incoming travelers, visitors. And I asked them, how many people have you detected with any illnesses coming into your country using that system? And like 0. So it's very difficult to pick up people that way. Yeah. And there's this potential shift now that's being discussed by WHO, PAHO, people like that. Instead of screening people coming in, you might potentially screen people going out instead, so that the onus is now on us, for example, to prevent someone going to another country.
That's being your brother's keeper. That's.
But that's not something that's widespread or that's being recommended right now. I just know it's something that's being thought about.
I think I just wanted to add there that it's not only, I think we need the support of the airlines, the cruise ships as well, because we do have that liaison with them, that if with public health especially, that if you have a passenger that's ill, it's your responsibility to actually inform the authorities of where you're embarking and disembarking, that this is a potential threat that you might need to look at. It's not being done fully. I mean, when they reach and they should give you a manifesto of all your passengers. Oh, we have so many ill, so those are the things we're trying to. I know they do it, but it needs to be enforced. Yeah. So those measures should be done.
And what we also have been working to put in place is there's a tourism health information system where we've asked. It's something that was developed by CARFA, and that's being implemented in countries, tourism-dependent countries, and they're trying to implement it here in Belize. So the hotels have an information system that allows their guests to report if they are ill. And we then have access to the numbers, not the actual details of the guests, but the numbers. So if the number of guests at a hotel that's using the system increases above a certain number, then we know that, okay, there's potentially an outbreak of flu or respiratory infection at the hotel. Yeah. But not all the hotels have bought into this system. Many of them are still reluctant to use it.
Yeah. Now, we had 5 total confirmed cases. Was that the number that we're at?
Yeah.
Any more suspected?
There's one other one that was I wouldn't say suspected. Another one that was tested. It was positive for influenza, but it was not H1N1. Okay. And I believe they continue to take specimens from patients that meet the collection criteria.
And of the 5 that have been confirmed, what are their status? Have they recovered?
Yeah, to the best of our knowledge, they're fine. Yeah.
Okay. Now, when there is a case detected, let's say there was a 10-month-old baby that was confirmed, right? 15 months, okay. So let's say they were at a daycare. I don't know what their whereabouts were. Do you then go into the community if they were in Mascal, let's say? Nothing against. Let's use some unknown village. Do you go into the community? What is the response when you have identified a confirmed case?
The public health inspectors in that district, they do the follow-up and the necessary case investigation. So they do go to the home. They assess whether there have been any contacts of the patient while the patient was ill. They assess whether there were any family members or anyone else who had visited before the patient got sick, who was sick, to try to determine whether there's any connection to someone who has traveled outside the country, or if there's any evidence that there's local transmission going on.
Yeah. And what's the incubation period? When do I come in contact with it and start feeling the effects?
the incubation period for H1N1, I think it's around 3 to 5 days.
Okay.
It can start 2 days to 4 days.
Okay.
It can last up to 7 days to 2 weeks, depending on the immune system of the individual as well. If you're a diabetic, an older person, your immune system is weaker, so you can stay with the strain even longer. So you are able to transmit the virus for a longer time.
That was going to be my next question. How long is it contagious? Is it just beginning, you know?
You can actually start transmitting the virus even a day before you actually know you're infected.
Wow.
I mean, if you already have the virus, you may not have the fever and thing, but you can start infecting individuals a day before, all the way up to a week that you are ill. And in those individuals who I mentioned afterwards, with a weaker immune system, they can transmit even longer.
Is the flu vaccine still available, and will that help? So if I have an elderly person in my family or a young child, should I go take them and say, I want to be proactive and get them a vaccine? Is that an option?
Yes, the flu vaccines actually, what we encourage is that you should get your vaccines even before the season starts. So that's the way how we want to do it. You get your vaccines, you usually would take around 2 weeks to develop those antibodies towards the viruses. But even though we're in the season right now and everything else, or when it's sporadic, we still can give the flu vaccines. It's better to have something than nothing at all, but we try to encourage it before the season starts so you can develop your immunity so that you can actually, probably, if you get the flu, you'll actually have a milder illness.
It doesn't mean you're safe from all flu.
Exactly.
It just means you don't get the really, really, really bad one. And what would you like for people who are watching? What do they need to know about preventing or protecting their own health and the health of their families? What can they change? What can they adapt? What can we do?
For me, the focus is hand hygiene and cough etiquette. So wash your hands regularly with soap and water, or hand sanitize. I think there are some key moments where you definitely need to wash your hands. So before, after touching your face in general. So eyes, nose, mouth are the specific areas, but as a rule of thumb, your face.
So what you're saying is, I touched this table because Kevin coughed on it, and then I touch my eye, and I'll get the I'm kidding. Potentially touch my eye or touch my mouth, and I will get the flu.
Yeah, potentially. If that table is, if Kevin
had H1N1, if Kevin had H1N1, coughed without covering, and it went on I touched it, and that's how I get it.
And cover your coughs and sneezes, preferably in your sleeve. So sneeze or cough in your sleeve. Avoid coughing into your hands or sneezing into your hands, because
then you get up and shake his hand.
Kevin might shake Kevin's hand. Kevin might touch the table, etc.
Use rags.
So
and the rags, yes.
Why are the rags bad? I mean, people always think it's very courteous to have a handkerchief or a rag to sneeze your cough in.
Well, you're touching the rag with your hands, and the rag is contaminated. So all you're doing is potentially recontaminating your hands every time you hold on to that rag.
And storing the...
Right, yeah.
Individuals afterwards might forget the rag there and somebody comes home.
Yeah, exactly.
Okay, my inner germaphobe is not handling this conversation well. But, I appreciate you coming in and addressing this. And at this point, we're only at 5 cases. Are you expecting to see more?
I think a realistic expectation is that yes, we're expecting to see more. What I'm hoping is that we got the message out early enough that it won't blow up, and we won't have a tremendous amount of cases. I mean, I think, as we've said, for the most part, it just causes, H1N1 just causes really a regular flu, except in those types of cases where there's a high risk for complications. But we don't want it to spread so much that we start seeing many people with complications, and then we start looking at potential deaths. So,
So from an
think
epidemiologist standpoint, you guys have expectations in terms of peaks and ranges and whatnot. So you're saying that this is probably just the beginning?
Potentially.
Pessimistically.
I think when you look at when we look at those, we actually have two peaks when we look at annually of flu. We have later in the year, and probably like around this time, we have another one. So we are looking at that, and I mean, I guess we look back at the conjunctivitis, lessons learned there, that we were telling individuals what to do, what not to do, and then it just blew up, and then afterwards, so I guess it's the same. It's the same measures, touching your face, touching your eyes, your mouth. It's the same way as the conjunctivitis. So I guess individuals now are aware that, okay, well, the conjunctivitis or things that we learn from, the same things we have to do now.
Yeah.
So those are the things we have to look at.
So we're heading into a peak season for flu because it's back to school too.
Yeah, that's
soon.
true.
Yeah.
Yes.
Well, thank you for coming in and telling us all this information. We appreciate that you're being open with the information. But I think learning that we can also have our own measures as well is perhaps the best takeaway from all of this.
Yeah.
So thank you so much for coming in.
No problem.
you.
Thanks for
We're
having
going
us.
to go ahead and take a break. When we come back, we'll be finding out about the Afro-Descendant Women's Encounter, where we had a representative from the National Garifuna Council. We'll find out more after the break.